So hi everyone, we've got a special guest here, Dr. Hoppy, Dr. Diana Hoppy, who works in San Diego. She is an OBGYN and menopause specialist. Everyone keeps calling you the menopause guru. Dr. Hoppy, I've been recommended to you by many people. So welcome and thank you for being here, because we're going to do focus on sex in midlife for women, what it can look like, the changes. Obviously perimenopause is involved, can be involved, menopause, etc., but also not just about that, just really how it can change kind of for other reasons. So I just have to say, the reason I first found out about you, and I have to read this out, is my friend was directed to you after her doctor had she went to her doctor for a lack of libido, and this is what her doctor said: do what most women have to do and get on with it. If you have sex once in a while with your husband to keep him happy, he will slay dragons for you.
Oh my goodness.
I mean, I don't know how she's not struck off, but that's the kind of rubbish we deal with. And she was a female doctor. And so
really?
My friend found
wow,
you.
That's very interesting.
Yeah, she wouldn't even give her a blood test or anything. So that's how my friend found you. And she's the #1 person who recommended you to me. So can we go from there? What do you think of that reaction, first of all?
Well, it's really sad, to be honest. First off, I created the Amazing Over 40 site. I have a website called amazingover40.com, specifically for women to get their questions answered and not have that type of response from a physician, so that they can find menopause specialists, doctors who actually want to do women's health, and discuss with them what's happening in their bodies and why the libido may have decreased as such. I also wrote the book, The Healthy Sex Drive, Healthy You, which
that's a big book. It looks really big.
It's actually a really good book. I spent a lot of time on this book. It was published in 2010. It took about 2.5 years to write this book.
Oh, really?
And it goes into all the reasons why your libido might be decreasing. So it's Healthy Sex Drive, Healthy You, what your libido reveals about your life. So the libido can be different reasons. So back to what happened with this woman and her doctor. I mean, basically her doctor wasn't at all looking into what's some of the reasons her libido may have been decreased. It may be because of hormonal changes. It may be relationship issues. It may be body image. There may be a lot of things going on. And just to say, just get on with it is not sufficient. That's really not a great answer. And that makes me sad when that happens and people come to me and say, my doctor said, just get on with it, and I have a glass of wine and just don't worry about it. Rather than, there are things we can do if it's painful, like if it's vaginal dryness. There's a lot of things to do. So that's really what prompted me and put the impetus to make the Amazing Over 40 site.
Okay, great. So I'm going to kind of put it into structure it in kind of midlife, then perimenopause, then menopause, stick them in there somewhere and talk about them as well. But one thing that really struck me was probably when I was about my 20s. I remember everyone saying, oh, women reach their sexual peak in their 40s, and and I kind of imagined all these horny old ladies, because when you're 20, 40 seems old, and and it's fantastic, and it's blah blah blah. So now I'm nearer that age, all I hear is it's going down. So was that a myth, that women hit their sexual peak in their 40s?
Well, I actually have a blog post about when do women hit their sexual peak, because there's a lot of misnomer about that too, because it really is up to the woman and her relationship and what's happening in her life, right? Because there's some women who hit their sexual peak in menopause or after menopause in their 50s and 60s.
That's good.
And a lot has to do with, is it a new partner? Is it a new relationship? Or has the relationship progressed and now you're in therapy and things are getting better? But a lot of times the libido will spike and go way up when you have a new partner, or better relationship, etc. But so there's a lot of factors that go into what is the sexual peak, but it really is when you feel most comfortable, most relaxed. Sometimes it's definitely involved with hormones, sometimes it's not. So it's a great question. And I really think it's independent as when a woman will reach her sexual peak, because there's women who will reach it in their 30s or 40s, let's say, but then there's women in their 60s and 70s who say, I'm now finding the best sex I've ever had. So it's a very interesting question.
Yeah, so much, so many layers go into that, like you say, and it really obviously varies. So that's good to know. But
but in general, but in general, libido tends to decrease over time, because if someone's in the same relationship and the relationship's kind of gotten into a rut, And then you put the hormonal changes, which you're going to get into, which we'll discuss.
Yeah.
So in general, to your question, yes, there is a decline in libido and potential decline in sexual peak, but that's very independent and really up to the woman and her partner, really.
Good. Okay, good to know.
Yes.
So midlife in general for women, regardless of, before the hormones start getting to us, what would you say most women come to you for help with? Is it like because boredom set in, other responsibilities have taken priority? I mean, talking about kind of sex life, like what do they help with?
I think I'd probably say like in the 30s and 40s, it's really an issue of time, and there's not a lot of time. So that when you look at what are the things that, and stress. So there's so much on a woman's plate with the little kids or kids in school or multiple things. She has a job. She has to juggle 5 million things, that sometimes having sex is not the first thing on her mind, right? So some men, they think about sex all the time, whereas women, it's like it's like the last on their list because they have an endless list of things that they need to do per day. And at the end of the day, they're tired.
Yeah,
and so
exactly.
the fatigue is really something that is important, because if you're tired, some women just say, oh, just do it and get it over with and we're fine, right? But really what she needs to do is probably take some things out of her schedule, that so she has time for her own self to do things she wants to do, like maybe get a massage once in a while and pamper yourself and have some time just to do things for you. And sometimes a woman should also get upset if her husband's not helping, like in the household, and not cooking or cleaning. And if men could do a little things to help in the house, they'd really do a lot to help women feel like they're being supported, and they're not, everything is on their plate. They have to do everything. So I think if men could, I actually have a little chapter about that, like the top aphrodisiacs for women is if a man will like pick up the kids from soccer and make the lunch or plan a weekend getaway, and that she doesn't have to do any of that. It really makes the woman feel so much more supported and happy, and then be feeling like, oh, I'm not like mad at him anymore because he's actually done something to help me, right?
Yeah. So prior to hormones affecting it, it really is kind of more of a therapy thing, is it? And it suggests
in perimenopause, before, like in women in their 20s and 30s and 40s, their periods tend to be still quite regular. And so if you think about the menstrual cycle, the time when the sex drive goes the highest is really mid-cycle, when a woman is ovulating. So mid-cycle, when her estrogen levels go up, the FSH is still low, the follicle stimulating hormone, testosterone goes up at that time also. So that's why sex drive gets higher. And it's kind of like Mother Nature trying to make it so that we reproduce, so that our sex drive is highest when we ovulate, so that the sperm can meet the egg and then you get pregnant and move on from there, right? So definitely there's times of the menstrual cycle, the time of the 28-day cycle, that you're going to have more desire, and that's going to be at ovulation. It tends to be like the second part of the month, like day 21 to day 28. A lot of women may have some more PMS symptoms. They're really not into sex. They're really kind of maybe more irritable, and they don't really want to deal with it as much. So Mother Nature kind of has it that way, so that reproduction occurs at that time and the species can continue. So that's interesting that mid-cycle, we definitely have an increase of sex drive at that time.
So if women are coming to you with these problems, that's a good thing to actually bear in mind, or to know that, and to keep an eye on it when you might be ovulating, because you might be worrying about, oh gosh, this is I just don't ever want to have sex. It's just, but I know it's bothering my husband. And then go, well, hang on, having that knowledge could really help, I would imagine.
Absolutely. And that's by having more information about what's happening in the cycle. How does the cycle affect her libido? So the sex drive definitely has time. Like sometimes women, when they're having their period, their actual bleeding, they don't want to have sex because they're bleeding, right? So that's the first maybe 5 to 7 days. And then at day like 14, 13, 14, 15, that's when ovulation occurs. So that's when most desire is going to happen. And then that's when she can realize, okay, well, maybe we can plan something then, or do a nice dinner, or go out on town, or something fun, and have something fun. And then knowing that the latter part of the month, it may not be as likely to happen, let's say.
Sure. Okay. So moving on to perimenopause. So can you just sum up what's the main reason a woman's sex life can change? I mean, is it everyone? Is it some people experience it, some people don't? I mean, it's loss of estrogen production. So
let me just clarify. Perimenopause is the 2 to 8 years before menopause. So menopause means 12 months without having a regular
Oh, yeah.
cycle, right?
Yeah.
So having a normal menstrual cycle for 12 straight months. So perimenopause is the 2 to 8 years before that. And that can when your periods start becoming more irregular. You might miss one, you might have two in a month, you might skip for a few months. And that's when the hormones are really going a bit wacky. Okay.
Yeah.
So they're not having that structure of the ovulation. And then what happens after ovulation, you make progesterone. So you first make estrogen, then you make progesterone. So those hormones are kind of like, it's like a roller coaster. And so that can make sex drive really kind of crazy in that if she's not getting good sleep because she's having night sweats and she's having hot flashes.
Yeah.
Also, sometimes you get fatigued because you're not getting good sleep. So that affects the sex drive too. So perimenopause can be a challenging time, but there's things we can do to make life better for that woman. And sometimes it's a progesterone cream that helps with night sweats. Sometimes there's some vaginal dryness that we can add some vaginal estrogen. So there's a lot of things we can do to make so that sex is still fun and it doesn't hurt during that time.
So what would you say the main kind of 3 to 5 reasons women come to you, or, you know, experiencing a problem with sex during menopause, perimenopause? Would it be like vaginal dryness, you said?
Well, it's a decrease in drive, and the decrease in drive could be due to vaginal dryness, so it's pain. So you have less drive because if it doesn't feel good and it hurts, like it's knives or sandpaper, you know, that's not fun. So
does it get that bad? Gosh.
It's just not enjoyable. And then they might come in because they feel guilty because their husband says, I don't want to hurt you. And she's like, well, I know, but I need to have sex with you because then you know, it causes somewhat of a friction, literally there. And there's a lot of things we can do to make that better. So one of it is the loss of libido. The second, women come to me because they're having a lot of symptoms of perimenopause, which can be the night sweats, the hot flashes, things like that. And also the body's changing. A lot of times then our bodies will change and the fat deposition will be different. We don't have the same metabolism. Our bodies are becoming different than when we were in our 20s. And a lot of women are frustrated because of weight gain and how their body's changing.
I was going to ask about that actually. So that is, why is it? Why does, like you say, it changes? Why at this stage? Is it to do with the estrogen again? Or is it?
Yeah. So basically, that's a great question because it has multiple factors. One is when we lose the estrogen with menopause. So menopause is when we no longer have cycles and our bodies aren't making that amount of estrogen and progesterone. So we can get the vaginal dryness even worse. And symptoms can potentially get worse during that time also. But we also decrease our basal metabolic rate, which means our ability to metabolize calories, to burn calories, is harder. That is, we have to eat less or exercise more to even stay the same weight.
Right.
Then when estrogen drops, it also changes the deposition of fat in our bodies. So that the fat that's normally in our hips and thighs now gets more into the muffin top, our little belly area. And so women might notice, why I have more of this kind of fat there that I never had before. And that is a hormonal change due to the drop of the estrogen. So there's different factors that go into why do we gain weight as we get older and why is there shifting of some of the fat with menopause.
And so what do you recommend with that? Because obviously like weight gain can cause body issue, confidence, loss of confidence, which doesn't help with this traction and all that kind of thing.
Exactly. And that's why it's complicated. It's not just one little pill you can take. But basically what I try to do is look at the whole picture of what's happening with the woman. And is she getting good sleep? Because if she's not getting good sleep, it's going to be really hard to lose weight. Because if you don't get good sleep, you're making more cortisol. If you make more cortisol, it causes more fat deposition. So they're related. Also, hydration is really important. So if you're trying to lose weight, you have to stay hydrated. You also have to take time to exercise and do the things for your body. You got to eat good food that's going to nourish your body. So we have to take all these, the stress level, like what's your stress? Because if a woman's stressed, your body sees it as a famine. It's a crisis, right? You're stressed. You're chronically stressed. Your body is going to be tight and holding on to the fat because it says we're in a famine. We need to hold on to fat because we don't know what's going to happen the next few months of no food. So there's a lot of things that go on that need to be discussed and need to be looked at. And that's why I wrote the book, for one. And the other is also on my amazingover40.com site. I have a transformation course that has modules about each of these aspects because it's a lot of things to learn. And most people don't talk about it because most women don't talk about why their libido's down or why they feel like they're kind of depressed about their weight and they can't lose the weight.
Yeah.
But you can lose the weight. It's just going to take a little more effort, watching what you eat, how much you're eating, how many calories you're burning, and also the hydration, sleep, stress control, all those things go in there too.
Yeah, and it can be quite a bad cycle because, you know, if you're stressed, you comfort eat, you know, if you're tired, you don't exercise as much. So it's quite a discipline when a lot of us are juggling kids and, you know,
Exactly.
everyone is, but it's, you usually put yourself last, and then
You nailed it
when
all
it
on the head.
filters into your sex drive, it's like, oh yeah, you know, then you got to do it with your husband, and no, it's a lot. It's a lot. It's funny, midlife seems like it should be something where, you know, everything, you got it all sorted, you know, and it just is a whole new set of stresses.
Well, the thing that's interesting, and I write this, I think in the book, but maybe definitely in my transformation course, it's called Getting Your Badass Back, and your brain back, your libido back, your body back, a lot of things.
Yeah.
But when you look before the 1900s, we didn't used to live this long. Okay.
Oh, right.
So women would live, probably the average age of lifespan would be like 50. Now we know the average age of menopause is about 50 to 51. So years ago, we didn't have to deal with what happens now. We live till about age 82, 84. So we have about 34, 33 years living in this time that we didn't have to do before. And now women are saying, well, hormones are natural and this isn't natural. Well, it's really not natural that we live till 84. And now that we're in this new age of technology and et cetera, we have to say, okay, how can we live the best life given we're going to be till 84 or so? And there's a lot of things to do that can help with that. And that's where, again, the website comes into play.
Okay, great. And I think on the website you mentioned bioidentical hormone therapy. Can you tell me a bit about that? Like what it is, the benefits, the side effects, that kind of thing?
There's a lot of confusion about bioidentical hormone therapy. Bioidentical, for me, the definition, and I use it as the same molecule that your body makes. That is, when we take estradiol and we take progesterone, either orally, transdermally, whatever route is being used, it's the same molecule your body's making when you're having your menstrual cycle. Okay. So the estrogen goes up, it peaks at mid-cycle, progesterone peaks about day 21 of the cycle. So those are the same molecule, the exact same molecule that your body's making. And they can make hormone replacement therapy or hormone therapy with those same molecular analogies, the same thing. Okay. Now there's synthetic progestins, like synthetic progester, it's called progestin, but it's like it's synthetic, and that's what they use in that big trial called the Women's Health Initiative. So that's not, quote, bioidentical. They did use Premarin, which is pregnant mare's urine, for the estradiol component, but Premarin has a lot of different types of estrogen, not just estradiol. So some women say, well, isn't horse urine natural? Well, it depends on what you say is natural, but they do make natural bioidentical estrogen patches, estrogen creams that are FDA approved, as well as progesterone that is made from yams and other sources that are available at like CVS, Walgreens, etc.
Okay. And are there any side effects? When would you recommend it, or like who would you recommend it to, and for how long, roughly, if you can even?
Well, that's a tough question, how long to be on hormone therapy. But first, let me say that if a woman is perimenopausal and struggling, there's a lot of things we can do. A lot of times progesterone cream, just a little bit, can make a big difference. So that's something I try to do, as well as trying to decrease the stress in her life and decrease some of the obligations she has. Then when menopause occurs and your own hormones really drop, we can give a vaginal estrogen for the vaginal tissues if that's the only complaint. We can give what we call systemic hormone therapy, which is where we can do it through the skin, through a cream or a patch, or there's also oral ways that you can do it. So there's a lot of options on what to do. So we can make it better.
Okay. And any side effects or?
Well, side effects, you can sometimes, if it's too much, you might have breast tenderness, sometimes anxiety. There's different side effects you can have from hormone therapy, but you want to get on the right dose. Once you're on the right dose, it should really make you just feel more calm, more brain focused, less mood swings, less irritability, less pain with intercourse, less hot flashes, night sweats, all those symptoms. Yeah.
Okay. So obviously this is all about women's challenges, but obviously a lot of us are married to men. And do you find that women come to you and say, you know, men, their husbands lost their sex drive, or their partner, or, you know, I mean, or they need no Viagra, or they've put on or something? Obviously it takes two.
Exactly. And I'm actually going to go back just a second, because I want to go back to the side effects you were talking about. There is a study called the Women's Health Initiative, And again, I write a lot of blogs about that. And when they use synthetic progestin in that group, the Prem Pro group, they had increased risk of breast cancer. They also showed increased risk of stroke and heart attack. So please go to the blogs and read about that, because I can really clarify about why that study had issues and why it really needs to be individualized regarding hormone therapy. So back to the men aspect, men can actually lose their sex drive in the sense that they have a decrease of androgens. Their testosterone will decrease about 10% per decade after age 30. So their libido can decrease also. And there's some men that they're like in their 70s and they still want sex every day. So it varies, but a man can definitely have less drive. And so they may want that her husband or may want to go to the specialist, his own specialist that can give some testosterone replacement, because there are ways to rev up the libido a bit. So it's natural for both parties to be somewhat decreased over time.
Yeah.
Sometimes can make it better too, because then, it's more equal. Yeah. But definitely if a man then says, well, the problem is just erectile dysfunction, and they take Viagra, and a woman's not ready because her vaginal tissues are like dry and what we call atrophic, which is not a great word, but it hurts. It can really cause a problem because the man's all revved up literally. And the woman's like, wait, this is not good, because you can have this erection for how many hours and I don't even want you coming near me. So there's things we can do to make that better. And I really think the urologist should discuss that with the man too. Like, what is the state of your woman? Like the status of, is she able to have sex and is it comfortable? Because again, lots of things we can do to make it so that both parties can be happy.
Yeah, and we all get middle-age spread, so perhaps it could be something that you do together. If you've both put on weight, it's also the man, obviously, that it could lead to lack of libido or loss of sex drive is to do with how your man is kind of dealing with midlife as well.
Exactly, because there's some men who don't maybe work out as much, or they're working really hard, they're stressed, and they're working like 60 hours a week, and they're not taking care of themselves either, right? So that can also be an issue, and that can cause more fat deposition, like you said. Now the thing about men, they can lose weight a lot faster than we can.
Right.
And that's because they have more testosterone, which makes more muscle mass. The more muscle mass you have, the more calories you burn. So I had a patient today and she's like, I'm trying so hard to lose weight. And my husband, he just losing 5 pounds a week and he's not even trying. And I said, it's frustrating. I totally get it. But men are different than women. Absolutely.
Okay. Actually, one quick bit of advice, if you wouldn't mind, if women come to you saying that it is them who's lost the loss of sex drive, what do you recommend women say to their partners to kind of make them more understanding, that lose the frustration? Just understand.
Well, communication is great, and then sometimes men don't know what's happening to women's bodies either, so they don't know what's happening with the cycles. Many don't understand menopause, as women don't, right, too. But men are really not knowing what's going on, and so they just think that the wife maybe is losing energy and interest in them, when it's not really them, it's really sex itself. So you have to look at what's causing the drop of libido. So again, we have to go through all those factors. Is it pain? Is it the relationship issue? Is it self-esteem? Is it, there's a lot of things that can go into it. And then once we start going into the different factors, we can target those and then be able to treat that. So we can actually make it so that a woman can then communicate with her partner and say, I saw my GYN today and Dr. Hoppy told me, the reason why it's not fun is because my tissues have now gotten much thinner. I'm going to be on this now estrogen or some type of vaginal treatment that will help the tissues and now it won't hurt. And then he might say, that's absolutely wonderful, because then he thought it was him when it wasn't him, right? Right. It was just her tissues are different and that's normal. Okay. Now there's some women who don't have as much of a change with the vaginal tissues and they may say, I didn't have any problem. Well, that's great. But for those who don't, who have issues, there's a lot we can do. And it makes it so that you can basically like come back together, because even intimacy, even if it's not intercourse, having some intimacy is really good for both you and your partner, for the general health for both of you.
And I think, I guess in marriage in general or relationships, communication is key. It's just how much men actually might want to hear about this stuff. So,
right. But I think some of my patients say, well, to their wives, well, when are you going to see Dr. Hoppy? Because don't you need that appointment to check that everything's good? And so, I can tweak the hormones a little bit. We make it better so that we're not having problem with sleep. We're not having irritability, so that we can make it so that life is better. There's ways we can make life better. And this is where really the gist of the site is to say there's hope. There's a
Mhm.
lot we can do.
Yeah,
It's
exactly.
not like you have to be miserable. You don't have to listen to that doctor that says, like in the very beginning, like you said, just chuck it up or just deal with it, right?
Chuck
Because
it
that's
off.
not right. I mean,
Right, I know.
that's not at all addressing the issue. And some doctors don't have the time. And I'm not saying that,
Mhm.
I'm lucky I have a practice that I can take my time with my
Mhm.
patients and really get to all the reasons of what are happening. There's
Mhm.
some doctors that don't have the time, and that's when you have to go to a specialist who will take the time and
Yeah.
listen to you and listen to all the things that are going on.
Okay, great. So, moving on to after menopause, sex after menopause. So obviously there's benefits to menopause. No periods, no PMS if you have PMS, not everyone
Correct.
does. No birth control if you've chosen to
Right.
take that.
That's right.
So what difference can women expect with their sex lives after menopause? How general is it?
Yeah.
You can speak on?
So yeah, there are some good things about menopause, and some women don't have to worry about getting pregnant, like you said, and all the other things. And some women feel a little more liberated, and others can get depressed with menopause
Mhm.
because they're no longer reproductive age. So they think like they're old, they're shriveled up, they're
Right.
no longer like reproductive age, they've kind of lost their zing. But in general, what happens is you can start having more bone loss, you can have cardiovascular changes. So the estrogen actually helps protect a lot of things. And
Mm.
so as a woman ages through menopause, there's an increased risk of heart disease, increased risk of diabetes, et cetera, because she doesn't have that estrogen in her body. And the
Mm.
vaginal tissues, like I said, can get more thin. But again, there's things we can do to make that a lot better. And
Mhm.
on the site, I wrote a lot of different blogs, and one's called From Ouch to O, about how
Oh
you can
yeah.
get your sex life back and how to
Okay.
really treat those things that are really, there's ways we can make it so much better. So I don't know how much to
Okay.
keep stressing that. Yes.
Okay, so not all women will lose their sex drive after. It's not, is it? It does vary
Not all.
from women,
If
women to
a
women.
lot of women can have vaginal dryness because that's a normal thing
Okay,
that happens.
right.
But if women have sex 2 to 3 times a week, continuing to use the organs, like,
Mm.
and having blood flow to that area, some may not have experienced
Okay.
vaginal dryness. So there are some women, if they have pretty frequent sex, they're like, oh, I don't have any dryness, things are great. Well, that's perfect. They're having a lot of sex, which brings more blood flow, right?
Oh, okay.
And the other thing is there's other medication out there also for sex drive that I want to let you know about. It's
Mm.
called Addyi, ADDYI. It's a medication that when I was writing this book, it prompted me to write the book because it's a medication for decreased sex drive in premenopausal women.
Mm-hmm.
Can be used what we call off-label in a postmenopausal woman, and it
Mm-hmm.
works on the brain. So it works on serotonin receptors to help increase the sex drive, increase
Mm-hmm.
thoughts about sex, increase desire, increase lubrication, etc. So that's a medication
Okay.
also that women can talk to their doctor about.
Okay, that's good to know. Thank you. And for women who are still finding a problem with it, is there any surgery that can help with if they're having problems with sex after
One
menopause?
other
Okay.
thing that can help with libido is testosterone. So some women use a testosterone cream or testosterone pellets. That's another thing that can help with sex
Mm.
drive. There's some procedures out there called Mona Lisa or one of those laser therapies that works in the vaginal tissue to kind of regenerate the vaginal tissue, literally.
You
You can do
recommend
this.
that? Is that?
Well, you can use that. You can use an estrogen cream or estrogen insert or estrogen, other types of things that can help. But some
Mm-hmm.
women really think that helps. It can
Yeah.
also help with, excuse me, stress incontinence.
Mm-hmm.
So if there's some loss of urine, that procedure can help with that too. But in general, there's a lot of ways we can help with the vaginal dryness, and the Mona Lisa, the laser treatments are one of the ways we can do it. But a lot of other ways, you don't necessarily have to spend $2,000 or $3,000 on that to get.
What is Mona Lisa?
Mona Lisa is a laser treatment of the vaginal tissues, and they call it vaginal rejuvenation.
Oh, of course. Okay, I didn't
So
know
a
it was
lot
Mona
of
Lisa.
women, and there's different types of procedures aside from Mona Lisa, but that's one of the major ones. But there's many others, and a lot of women think, oh, they have to get rejuvenated,
Mm.
okay, and
Mm-hmm.
that now their tissue doesn't look normal anymore, and they need to
Mm.
get their labia, which is the lips of the
Yeah.
outside, to get them look perfect, and they go to a plastic surgeon. Well, you really don't need that to get back the vaginal tissues
Right.
and get your sex drive back. But someone would like to go that route, and that's an individual choice.
Yeah, that sounds more aesthetics in a way as well.
It's more what? I'm sorry?
More for the look of it,
Well,
aesthetics
yeah,
in
and I
a
mean,
way.
there's some women, they want to go to the plastic surgeon and have their labia look like it was a teenage. Well,
Right,
that's not normal. I mean, that's
right,
the
right.
age. there are normal things that happen to our body, and that's one of those. And there's no need to have to go that route. But if someone feels better, that's their choice.
Okay, well, great. Well, thank you. That's just wrapping it up. It seems like there's a lot of hope. There's a lot of potential issues that might happen, but it seems like there's pretty much an answer to most of them. I mean, it's just
And the thing is, yes, and it may not be an exactly overnight solution. I mean, sometimes that's why you need to have a doctor that's going to work with you, talk with you, say, is this helping? Is that not helping? What is the things that we can do for you? Because you're different than your neighbor versus the one across the street, and some women might like to do a pill of combination of the hormones. Some may want a cream, some may not need that and just want vaginal treatment. So that's where individualized treatment is really important, and finding the specialist like we were talking about to really be able to say, this is about you. Because most women, they put themselves, like you said, at the last of their list. And finally, sometimes with menopause and perimenopause, they're putting themselves now maybe at the closer to the top of their list. So now they're taking time for themselves, which is great. And that's one of the things I really want to start doing more, is what we call retreats. I want to do traveling with women and have them able to understand that now's the time that you can really embrace the changes and see what's happening with your body, and be able to experience things that now you haven't experienced before. Like just make it a time of renewal, rejuvenation, not with vaginal rejuvenation, but just rejuvenation, just with different aspects of your life.
Yeah. Well, thank you so much. I mean, I still can't get over what my friend was told by that other doctor about he'll slay dragons.
Yeah, that's really sad.
There we go.
It's troubling, to say the least.
It is. But no, you've given us great advice and lots of hope, and yes, positive stuff. I mean, we'll all get through this somehow, and this stage in our lives, whoever's at it. And it's good, even if you're not there, to know what may be coming, so that
right, exactly, so you can be proactive and take some steps to say, okay, when I get to those symptoms, I know I can go and get some different treatment, different options, the progesterone cream, the different hormone therapies that are out there.
Great. Well, thank you so much. And I'll put lots of links below the article as well for lots of things you've said, but this is going to be a Zoom recording. And so it's been a pleasure to speak to you.
Likewise.
And, thank you so much. And
thank you so much, Madeline.
Something else.
Loved it. All right. You take care.
Bye.
Okay.
You too.
Bye-bye.